So I would like to thank you for the opportunities for me to come over here. So my name is Riyana Miranti, but people usually call me Mira. I'm a senior research fellow and convener of Indonesia program at MAR Institute for Governance and Policy Analysis at the University of Canberra. This afternoon, I will present about, one of the research projects that I've done. It's about evaluating effectiveness of targeting and lessons from social protection programs aimed to children. So what is actually the motivation or a background for this project? So there has been works in the area of international development, and there has been a shift from universal targeting, so like a policy intervention that targeted to everybody, to particular or specific targeting. And then there has been a discussion that poverty, which is probably the simplest measure of well-being or welfare, which is like based on the income expenditure, as the most common measure of welfare. But in the literature, there has been a discussion to move this away to a multidimensional measure of well-being. It's about more than addressing income poverty when we talk about well-being, when we talk about people welfare. The challenges for the post-2015 agenda, Millennium Development Agenda, is to reach universal primary education for all children. And then there are two actually interventions that have been done. One is by reducing the cost. It's like actually providing cash transfers, either this condition, there are conditions attached to the transfer or unconditions. Like, for example, giving fee subsidies, tuition or fee waivers, or like provision of the scholarship. But the other side of the intervention is like increasing the preparedness, like early childhood development or health interventions such as immunization and nutrition, like a program like school feeding or take-home ratio. So it's like, so they provide like it's like lunch pack for the kids to take home. So they have been provided with by nutrition to prepare them to actually have like some kind of like enough nutrition to prepare them to actually study. So this report is about is there are two research objectives. One is to evaluate the effectiveness of targeting of social protection programs that have been existed in many countries, and then to examine the outcomes of the programs, and then to identify the challenges and the lessons learned. So what can we conclude from many programs that have been existing around the world? And then we examine the data and literature of this program, which for particular case studies for Colombia, Brazil, Indonesia, and South Africa. So what is the first question? What is targeting? It's actually a mechanism to identify eligible individuals and screening out the ineligible group for purposes of transferring resources. So we have to, when you have a policy intervention, you have to target who are the individuals who are eligible to accept this program intervention. Then why we need to have this? Because we would like to maximize the benefit of the program, which is, in this case, to actually maximize reduction in poverty or increase in terms of the social welfare. Then again, we always have a constraint, we always have a limitation, which is a limited budget. So we have to make sure, given the really limited resources that we have, we need to make sure that our program, the policy intervention targeted, will reach the beneficiaries, the eligible beneficiaries. So what the programs have been done, they include, can be a single criteria, or can be also multiple criteria. So like, for example, of course, you identify who are the poor or extreme poor, and then you can actually incorporate the geographical targeting to, for example, identify regions that are really in need. And then sometimes if the program also really targeted, for example, to elderly or household with children or a particular ethnic group, depending on what the programs existed. And then they can use multiple criteria. So the targeting process is really complex. So it's like, what is the aim, then who decides the eligibility criteria, what are the criteria, and then when does the identification of beneficiaries occur, then who identified can be like technocrats, communities, and even beneficiary itself if it is a self-targeting. And then what information is available to facilitate the targeting process. But at this stage, I would like to actually focus on the point 8, 9, 10, whether the transfer actually delivered to people identified as eligible and to people who are actually poor. And how large are the inclusion errors, how large the exclusion errors. And then what are the financial costs of this targeting process? And then what are the secondary consequences of the targeting process? So before we start, I guess I just would like to, for those who are not familiar, like to discuss types of targeting or targeting mechanism that are available. So the first one is means-based testing. This is the assessment based on income, asset, or wealth of the applicants. It's usually very, very costly. Particularly if you use the incomes, it's very expensive, and then sometimes also probably inaccurate because it's really hard for people to reveal their incomes. So that's why I guess it's costly and also maybe less accurate in terms of the to get the reliable data. So the most common thing is using the proxy mean testing, which is a combination of many characteristics that can be used as a proxy to replace, like, for example, income. So it can be like the age of the household head, and then or maybe like the education level of the household head, and then the living condition of type of the, for example, type of the floor or types of the roof of the house, and then you use this combination of characteristics as a proxy and then applied weighted weight, different weights to different indicators, and then this is comes up as the proxy means testing. And then, of course, categorical or demographic, so depending on the age of the recipients, or what is more common if we talk about the social protection program aimed to children is household with children. And what is also common is we use the geographic targeting because you want to really target the areas where the intervention are needed. And it's possible also there is a community-based targeting, so where the eligibility of the beneficiaries is decided by the local community members. So that can be also possible. And self-targeting, which is probably maybe not really common, but there is in the literature. So one of the examples is in the public work programs, where actually people identify themselves, I would like to be involved in this some kind of infrastructure or public works project, and then they self-target, okay, I need to be involved in that particular program. But what is more common is we have also multiple mechanisms. So we try to look at a lot of literatures about the programs which are actually aimed for the children and the targeting mechanism. And if you look here, it's mostly, they are conditional cash transfers. So it's given cash to the household with children, but there are conditions attached. Like, for example, the kids have to be enrolled at schools, for example. And then if you look here, before 2000, only for 32 programs, but between 2001 and 2010, it's a huge jump between almost like 100 programs around the world. And then if you look at here, so this is the targeting mechanisms, they are the combination of the mechanism that are used by the programs. So what I discussed earlier, the majorities are a conditional cash transfer. And if we look like here, are still dominated by programs in Latin America and the Caribbean countries. Types of targeting, and then some histories about how many programs around the world, but now is how actually to measure a targeting performance. So it really depends on program objectives and also the criteria. And then I just quoted here, cited two measures from Slater and Farrington. So they define two things: targeting effectiveness, which is defined as a measure of how far targeting approaches and mechanisms succeed in making transfers to intended beneficiaries. And targeting efficiency, which already combines effectiveness with a measure of the cost of implementation of the program. So effectiveness and efficiency. So some indicators, if probably like some of you are familiar, and then sometimes hear about these targeting errors like inclusion, exclusion. Also, there are some other indicators like positive outcomes across targeting mechanisms. So like, for example, you compare poverty before or poverty after the implementation of the program. And again, like there are also like literature that talking about only targeting effectiveness, but also some indicators about, so not only positive outcomes, but targeting can have also negative social consequences as well. And then some literature also discuss about the targeting costs. So the targeting errors is first the inclusion errors. It's the proportion of the program beneficiaries who are technically ineligible. So those who are actually are not eligible to get the program, but because of the error, is actually included into the program. That's inclusion error. But there is also the second one, which is exclusion error. So the proportion of eligible individuals or households that do not receive program benefits while they actually need to receive it. So they actually should be receiving the programs, but because of these errors in implementation or like in the planning or what else, they're excluded from the programs. So this is just a different things how to explain it. So like, for example, we have a poor or non-poor, and then the household excluded from the program, and then this is household included program. If, for example, they are poor, but then excluded from the program, that is exclusion error, so under coverage. But if the household are non-poor, but included in the program, that's in inclusion error or leakage. So this is just how to calculate this. So if you are poor, but then excluded from the program, then the exclusion error is 25%. So like 10 divided by 40, which is the total number of poor. But then if you are non-poor but included in the program, this again is like 25% of inclusion errors. So this is the inclusion error, the exclusion error. That's probably the most common indicators of targeting performance that discussed in the literatures. But there are also other things that other indicators, like for example this one. So about targeting effectiveness. So the literature focus on how much more the group defined as the poor or beneficiaries have gained from the targeting scheme than they would have with a neutral universal scheme. So you compare the benefit if we target the group with really specific targeting, or if the program is actually intended as universal targeting to everybody. And so it's like how large the transfer benefit go to the poorest quintile of poorest quintile. So like how much is actually the poorest get the benefit. And this is like the proportion of transfer received by individuals of household falling within. Really depends how you define the poorest classification. If it is talking about the quintile, then it's about like 20% of the income distribution. So we quoted we cited the work of Cody with his colleague, who found that median targeting performance of the evaluation of, so we evaluated the 122 targeted anti-poverty intervention for children, and then we found that the median targeting performance is 1.25, which means like the program transfer 25% more to poor individuals or household found in the bottom quintile, so it uses like the bottom 20% of the population. In comparison, if the program is a universal targeted scheme. So it means that this is progressive targeting. So the poor actually gets more in comparison if we provide intervention, if we provide transfer to everybody. So if it is -1, means regressive targeting, which means that the richer probably gets more. But if it is 1, it's actually neutral targeting. A program usually uses a combination of a targeting approach. So not only 1 or maybe 2. So as you can see here, what's really interesting is the more targeting approach the program actually involve, it does not necessarily mean that the targeting performance actually increase, because it can be more costly, it can be also becoming more complicated. Until up to 3 targeting approaches, it seems that the median of targeting performance is actually increased. But when you include 4+, then the benefit for the poor actually diminishing. So that is something that's really interesting here, that having many targeting methods not necessarily means that your the targeting performance is actually better. And then by the targeting method, from what we found here, if you use geographic targeting, it's actually the performance better. And the proxy means testing is also actually, the targeting performance is also better. So that is not really surprising in the sense that in practice, geography and PMT, proxy means testing, are the most common method that used for the program to target the beneficiaries. And then what are the secondary effects of targeting? They are positive and they are also negative impact of the targeting. So for example, there are possibly a multiplier effects. Like for example, like one transfer that targeted for one vulnerable categories may also benefit another vulnerable categories. Like for example, if the cash transfer targeted to the children, right? And then to some extent, although like for example, this program is intended to the children, but it will also have a multiplier effects, a positive effects for the household in general as well. That can be possible. Then we can actually see there are multiplier effects in aggregate. Then it may be reducing poverty in that particular area, although maybe not necessarily that everybody in that area are poor. Right? For that is the positive multiplier effects. But there can be also negative impact, like there have been cases on information distortions, for example. It can be also there is incentive distortions, like beneficiaries may lose motivation to work. And then also there is a social stigma, then you feel like some people may be feeling depressed, or when there is an attachment, I'm a recipient of the cash transfer, that can also be happening. And then there is also some politicization of the program that can be also possible. Then we will discuss about cost of targeting. The cost of targeting, I just would like to briefly discuss about the types first. So the first, administrative costs. So administrative costs, like direct costs that related to, preparing the program, and then, for example, to provide all the documentation. So that is the administration cost. But then the recipient actually bear its private costs, right? For example, when you want to register into the program, says you have transport costs. Time as well, like is time to travel. So those things also can be categorized under private costs. And then there is also social costs because of one community receive this program, that it may possible also some deterioration of community cohesiveness, because all of us receive the transfer. And then there is also psychosocial costs, like what I discussed earlier, is about stigma, about self-perception of the recipients if they are participating in the program. And then political costs. For example, if this local government do not include a certain group of population, for example, then it will have a political cost to this local government. That is, for example, so the corruption kind of thing that goes to also can be also example of the political cost. And again, incentive costs, because then, as I mentioned earlier, it's possible then you have the loss incentive, for example, to do productive, productive work, or it's just because the beneficiaries then change their behavior in order to receive the program. And then this is the relationship between the targeting cost and also the coverage. So actually, so this is the narrow targeting. So the administrative, indirect, private, social process can be actually high when you are focusing on the particular group of population. But if we have a universal coverage, so like everybody got the program, then actually this cost can be lower, because you don't need to really target which group that will receive the benefit. Then the targeting performance versus cost of targeting. Costs can be also complicated, because many costs are associated targeting rather qualitative or can be hidden. So like something that it's really hard to measure, like for example, in terms of the leakage, right? Or in terms of corruption that might happen during the implementation of the program, it's really hard then to measure it. So it can be complicated. And then there is also a trade-off between the targeting accuracy and also the cost. Like here, if this is the x-axis is about the practicality, the y-axis is about accuracy, and mean tested when we have income, here is about the expenditures, the cost can be actually really high. But then if you, the subjective self-assessment, then whether you are actually poor or not, then the cost implementation is actually low. But of course, accuracy can be also low. So what are some measures of the cost? Sometimes we say that the administrative cost, you can't quantify the administrative cost, but for the hidden cost or some the qualitative cost, we usually mention is like maybe around how many percent as a proportion of the administrative cost. And then there are also some measures about transfers efficiency as well in terms of the cost. And then literature also discuss about cost effectiveness. which is about the ratio of the amount of the effect of the program for a given amount of the cost incurred. So, for example, additional years of student participation per 100 additional dollars invested in the program, for example. Or number of cases in, this is a use the area reduced per dollar spent, or most of the empirical evidence for targeting a cost effectiveness limit the analysis to administrative costs because that is the one that can be measured. But for other costs, sometimes it's really hard to measure. So that's why the empirical evidence for this kind of analysis are still limited to the ones that can be only measured. So the one that are hidden, like for, or the indirect costs, for example, is hardly can be examined. So now we move to the case studies. So just give you a little bit of backgrounds about our case studies here. So for the Colombia one, it was created in 2001 as a response to an economic crisis that hit Colombia. It was donor-driven, designed with the support by World Bank and also Inter-American Development Bank. But then in its development, it has shifted to full funding by the central government. There are two objectives. First is to offer the safety net that can alleviate poverty and protect poor households from economic shocks. But also in the long run, hopefully it can promote human capital development. So not only in that particular short-term period of time that the kids can enroll to the school, but hopefully it will also promote further human capital investment, like the children can continue to study longer at school, and then promote human capital development in the long run. Using the geographic and the proximity test here, and then the beneficiaries' information collected by municipal authorities, but then consolidated by the central government through the information system called SISBAN. So what is really interesting here, there are a collaboration between municipal authorities and the central government. But although the authority at the end actually held by the central government. But what is also really interesting, they have really good information or data system to identify the potential beneficiaries. In regard to the inclusion error and exclusion error, they have inclusion error is quite high, which may be due to, in fact, that many families may have moved out from poverty. So there are probably lag between the data itself, then when there are like some, particularly for those who are in the, those who live close to the poverty line, so they're actually quite dynamic, move in and out from the poverty, then this may actually create high inclusion error. But there are exclusion errors as well because the program registration occurs in certain windows of time. So like, for example, if the eligible beneficiaries are not able to register during that period, or they miss out. So this is Brazil. It's one of the largest CCTs programs among developing countries, also created in early 2000. So these are the target population, targeted poor families with children, and then also there is an attachment there with for those who have pregnant women in the household too. And then the condition attached is like have the women need to have a prenatal and postnatal checkups and keeping vaccination complete when they have the babies, and also to make sure that the children who receive the cash transfer always condition on the children enrollment attendance. This, for Brazil, they use geographic and mean tested mechanism. Again, one of the key elements for the implementation of the targeting is a setup of unified information system. So this is a database, unified database information, which collect the information of the beneficiaries. And there is a shared responsibilities between central and municipal government. And there are also the verification of income data because they use means tested at the central level, although it's still limited for the formal workers only. And then multi-dimensional indicators are also used in the verification process. So to make sure that the income data that are collected is hopefully is also valid. There is a limitation, one of the limitations of the program that discussed in the literatures. They use quotas based on the estimation of poverty rates at the municipality level. But interestingly, the estimation are based on the survey data that are representative at the state level. So they are not providing the correct indicators or the estimates of the poverty at the municipal level. So it can be overestimated, it can be underestimated. The program has large exclusion errors, but it's the smallest for the Latin American countries. And this is the case studies of Indonesia, maybe many of you are familiar with. It's also launched to mitigate the adverse impact of the economic and financial crisis in 1997, 1998, in 2005, 2006. Indonesia adopted the unconditional cash transfer and was initially largely also donor-driven, and the program delivers quarterly cash benefit to extremely poor households. And the eligibility of households are verified regularly, like through school enrollment, attendance, targeting use, geographic proxy mean tested, and demographic mechanism. To minimize the inclusion errors, the richest 20% of the districts from each province also were excluded from the program. And if we explained earlier, in the case of Colombia and Brazil, they have this unified database system to identify the beneficiaries. And then for Indonesia, there have been a development of PPLS, so as a database which also consists of the 40% of the poorest population that is used then for targeting this program. So what is really interesting for the South Africa is this is a little bit different in comparison to the other studies, the other programs. Although the implementation is still administered by the national government, which has both at the national and the provincial offices, but the role of civil society to initiate and campaign for the changes is very, very crucial. So like, for example, when they would like to expand the coverage of the program, is the role of civil society is the one that really, with their strong campaign, they try to initiate the changes until the government actually listened and then revise the program. So, which is a little bit different from the other programs which have been launched as either the response of shocks or crisis and largely donor-driven. But still, it has high inclusion errors, which is due to, like, for example, lack of required documentation, delay in getting birth certificate, like it may happen in other developing countries as well. There are barriers in getting birth certificates, which actually are documentation required to get the program. And then sometimes the recipient, the beneficiaries also don't understand whether and are not aware that actually they are eligible to get the program. They're just not aware that oh, the program is existing to help me, and then, yeah, they just don't know, lack of knowledge, maybe because of they live in remote areas, they don't have access to information, or just simply they just don't know how to apply. And lack of interest, as the amount of the grant provided may not be sufficient enough after taking into account other costs. So, like for example, if the place to, for example, to register is located in the, in the big cities, while I guess it's the poorest from the remote islands need to spend high transport costs just to register, then it's not worth it. And then intend to apply, but maybe also thinking, oh, it's in doubt whether they're actually eligible or not to receive the grant. And then from the supply side, it can be also really complex process, complex registration process, and maybe also like slow bureaucracy system. So it just like takes so much time. There has been an increase in education enrollment and attendance among the primary and secondary school, but full coverage of primary schooling has not been reached and lacks remain for the secondary schooling. So there have been a positive outcomes of the program, but then, yes, there are still works to do. The lower the baseline of enrollment is, the higher the impacts on the educational enrollment, which makes sense. When you start from the lower base, then with the program, the impact received is probably higher. Then, as I already explained here, only few programs that focus on dropout children to bring them back to school. And then the outcomes of the program did not depend on the size of the contribution of the administrative costs, which is interesting. So in the report itself, in the appendix, we have an analysis that apparently, although, for example, you spend so much for the administration costs, it's not necessary that education outcomes of the program actually also high. So what are the challenges? I think there are 4 challenges in practice. To summarize, that the programs may not have been effective as the programs do not reach all the intended beneficiaries. And then the programs may not be cost effective due to high administrative costs and unnecessary operational efficiencies. For example, corruption during the implementation of the program. Design of the program sometimes is complex, uncoordinated. And there are sometimes also argued that social protection programs are usually designed for short-term perspective to reduce current poverty and not long-term. So these are almost at the end of the presentation. So lessons to learn. I think in general, the combination of several up to 3 targeting methods improves targeting performance. That's what we found. The key elements that may help to reduce inclusion errors, so those who are included but actually not eligible, is like have a data verification system, which needs to be always checked for the accuracy and information provided by the families, and then also include the data that are not easy to manipulate. Then what is it? It's like in the setting of decentralization, as maybe having the centralized information system is the key in order to reduce the risk of clientelism or political capture. And then transparency in the targeting process is maybe, for example, including the making public of the list of beneficiaries may help reduce inclusion errors because there is higher social control. So make the list is publicly available. So there is, if you want to do something not legal about it, or there is always a control from outside. And then have a permanent data updating process in order to identify those who do not need the program anymore, and have a clear exit rules. The verifications need to be done. So for those who are not eligible anymore, then they need to have a clear exit from the program. So the key elements of targeting system that may help to reduce exclusion errors, I guess, is have a strong communication system, so the potential beneficiaries know about the program and register. So they are aware that there are programs that they are eligible to the program and they can register. So have permanent registration spot, so the eligible families have opportunity at any time to access the program. So this may also correspond to the examples for Colombia, where some families miss out the registration because it's only be provided in really limited time period of time. And also have registration spots that are accessible to people in terms of distance and transportation costs. And then also about documentation requirements. Some people do not meet documentation requirement and get excluded, which is, I guess, is also a challenge because like we want to reach the poorest, but they are the ones that probably lack of documentation, particularly if, for example, you need the birth certificate to register to be eligible to get to get into the program. Then efforts to reduce inclusion-exclusion errors may also costly in terms of financial resources and human capacity too. Although most transfers are intended to reduce poverty, perfect targeting is probably just possible in theory, but practically impossible in reality. And quantifying all cost targeting is complex, because like I explained earlier, not all the costs can be measured, can be quantified. And there is always a trade-off between accuracy and also the cost. And as is shown, I guess it also requires time to learn from the implementation research, and also everything I think needs time. And then we just need to learn from the implementation, what lessons to learn, and then we need to try to improve the program to minimize the targeting errors. And that's all. Thank you very much.
Do you have any idea why we still implement it in Indonesia even now? Like TNP 2K program for the unifying database and everything. And then the second one, do you also see about the universal social security schemes instead of mean tested? Is there any, do you have a comparison or any drawbacks, advantages for both systems? Thank you.
So the first question, sorry, is about the proxy mean tested, is it? Like we still use that one. I guess it's probably, from what we found from the literature, I think the discussion is because that is probably the most practical method in the sense, because if we use mean tested, that is actually using particularly income as the indicators, right? But if we use the proxy, we actually look at the combination of indicators, measures that still correlates with income, but not income. I guess if you can get income correctly, that's the most perfectly ways actually, right, to get like something really accurate. But if not, then the proxy mean tested one is the one that's probably closer. It's using the weighted average of the proxies, like to represent the welfare of the beneficiaries. I think that's probably the first one. And then the second one is, I think that also answer your questions about the means tested. Maybe that's also the disadvantage of the mean tested mechanism, because it's really hard, I think, for people to reveal their correct income level. That's the thing. The universal thing, I guess, is the universal is, I mean, if in terms of, for example, in the field of poverty, for example, right? What universal is, for example, when we talk about the program that targeted, not really specific program, but we always talk about the importance of economic growth, for example, right? Economic growth is for who? For whom economic growth? Economic growth is for everybody. Then it's for what is it? For the rich and also for the poor. And if a trickle-down effect actually successful, then the benefit will also be will reach the poor. But it may not be the case. So I guess it's like, that's why the targeting is important, because the intervention would like to, really target it to the poor. And then I guess it's why there is always an argument whether universalist or the really social protection program, which one is actually more effective. In the program that we look for, the programs that we cover in our project here, interestingly, for those programs that targeted to children, the median of the program actually better for those who are targeted particularly for this poor household or the children, rather than universal program. So there are some indicators, although I cannot actually speak for all, but this is the one that we cover here. The literature that we cited, they found that the program is actually progressive. So actually giving more to the poorest of the population in comparison if we actually provide the same thing to everybody. So that's it. Yeah, I guess that's okay.
Yeah, thanks so much. So certainly that's very nice research, but I really don't think that it's also cover about the early interventions for social protection of disabled or disabled children, because we know that Indonesia right now already ratified disabled aid this year. So what do you think that the next speech really? Are you sure that the government really can provide the early interventions for disabled people? Thank you.
Okay. I guess if they are poor, that can be actually included, but not specifically targeted for disabled children. That's it. Yeah. So if they are disabled children and they are poor, they may be included. Might have been included in the program, but there is no program. So far, my knowledge. Apologies if there is actually a new development that I may miss, but I haven't heard like a really social protection program targeted for disabled children, which is, I guess, personally, I think is very, very important as well. So it's good feedback. Hopefully, sometime in the future. Yes. Yeah.
Okay, thank you, Bu Mira. I have two questions.
Yeah.
The first one, it seems clear that most of the poverty alleviation programs are funded by the government and international agency like World Bank. Based on your reason, did you find any poverty alleviation program which funded also by the private sector? For the example, they are intend to allocate their GSR and then they work with the government and probably with the international agency as well to support the poverty alleviation program. And the second question, in your opinions, based on your research, is there any probably overall the best programs to be adopted in Indonesia? Or maybe you think that poverty alleviation program in Indonesia run in the right track and only need to be adopted during to the certain condition? Okay, I think that's all. Thank you.
So I guess the question, the answer for that is possibly, but not really in this large scale program. For example, because the corporate can have a social responsibility as well, right? So they may have like provision of scholarship, but we cannot actually say the social protection program, but they may have the social responsibility like to, for example, to contribute to increase the social welfare of the community, for example. So they may provide scholarship. When I did my first degree last time, I mean, like there are like scholarship provided by banks, for example, to help these the children are from disadvantaged background. So that can be. I mean, that's the role of the private companies, right? But it's not in the large scale, I guess. Yeah, so that is the one. And then for the second one, it's about poverty alleviation program. Interestingly, the conditional cash transfer that we have is actually we adopted based on example from the other countries, from the Latin American countries. So they use that as examples, and then because it works in other countries, we use it, and then poverty still existed, but I guess it's always something that the challenges for developing countries, I guess. So Kalau sudah tidak ada pertanyaan lagi, mungkin I think saya mau terima kasih banyak atas kehadiran ini teman-teman semua. Semoga all the best. I wish you all the best for the program, and hopefully next year sudah di Australia semuanya ya. Assalamualaikum warahmatullahi wabarakatuh.